All right, we're seeing if this is working today. Good morning, and happy Valentine's to everyone out there. And you must love yourself so you could then love everyone else. Hello, Shrew, Diva Butterfly, Karina, Conde, Marcella. Good morning, Kay Bizzle. Good morning, good morning, good morning. All right. I am listening, learning, and chit-chatting every day. Thank you to my Instagram followers. Oh, don't forget TikTok. I'm sharing the dance, right? I don't know if I can do this or not, but it's dance of life. And we are here dancing. All right. Oksana, Safale, Amber, good morning, good morning, good morning. I am so grateful for everyone every day. Oh, our new family building guide is out. It's on Amazon in the week 2 or 3 quickly. A nominal fee in order to get a lot of really great, amazing stuff. I'm so grateful to everyone for sharing and allowing me into your lives. Mercedes, good morning. Moral depravity. And I apologize for my dyslexia and my inability to read your names properly. Please forgive me always. Cirrus Clan, hello. Kaylin, TT Mandy, Amber again, Nicole, Becky Ann, hello to you and everyone. Amber, thanks for finding us on TikTok. I don't know. Let's see. Hannah said, hey, we got to try some TikTok. And I'm like, I'm afraid to do TikTok. I'm afraid to dance and sing and all that stuff, but we all need to be willing to put ourselves out there and sometimes make us look like a little bit of a fool, right? But in fact, no fools are there. It's only having fun and living life in a better way. Happy Valentine's, Erin. Hello, Dottie Drew. Good morning. Sherlyn. Hi, Manrique. And Sylvia again. Buenos dias, Diana. Mercedes, thank you. Right, what are we talking about today? We're talking about love. And Valentine's is about love, love, love. And you must love that which you hate. And who doesn't hate fertility shit, right? But when you learn to embrace it and love it, the universe will open up a bigger benefit for each and every one of us. When you love what you hate, hate becomes love. Epinephrine and cortisol go down and the blood flow to the pelvis. Pelvis comes up, right? We need more blood flow down there so we can have joy and happiness up here. And I know it sounds crazy. I hope you guys can all hear me clearly. And we're sharing a lot of love and creativity on this beautiful Valentine's Day. But every day, it's a love day, right? And you got to love life even when we're depressed and sad and angry and mad. Those are our natural progressions of life. We are naturally feeling pain. And when we feel pain, we don't want to move, right? But the pain is pushing us to move forward and get off of our couch, our duff, right? And listen and learn from crazy people like Kilts, right? But there's so many great people out there that have shared ideas to take us from what we're failing at to see the failures as pieces of the puzzle and the path to the successes we live. And if you haven't checked out my Mind, Body, Smile, check it out, drrobkilts.com, check it out. I'm simply sharing thoughts and ideas, and I've been sharing for a long time, and I'm hoping to build my YouTube stuff, right? I want to build YouTube. And I'm working on maybe if you get to subscribe and like on YouTube, along with all these others, we're going to have many more gifts to share, affordability, quality, access, and all of it. And by April, I'm praying and visualizing Sarasota open. We're getting Atlanta, Dr. V, working with the team to get us doing IVF and transfers down there. And thank you to my Colorado amazing team with Dr. Magarelli, who's listening and learning in my craziness that I've been sharing for so long. All right, let's see here. Oh, Jennifer Marie, worried my betas are rising slowly. Oh, you're good, you're good, you're good. Listen, we must visualize the beauty of what's coming or what's there and not to worry but have wonder in the amazing journey she or he or the gods are giving us. So we don't know what's going on, only she does, right? He does. Whatever your choice in labeling God, God is within all of us. And that's the great, crazy, amazing journey for us every day. Yes, Atlanta be great. We're working on it. Chris is helping get Dr. V and Sarasota. Really excited about that. We are going to need help. We need to build our donor egg program. We need more women of color donating, Black women, brown women, all red, all size, shape, colors. We need them. We're going to develop that and build it so our egg bank for black, brown, red, yellow, white is just overflowing with abundance for everyone. But we need more women of color in order to build our egg banks because there's so many in need. All right. 28 is it possible to transfer to Tajan Nichelle? Maybe. This is not a no, it's a maybe. We're not against it, but we have to look carefully in making the decisions of which is the best way to go. One is the way to join with you to build to 2 or 3 or more in building a family. So talk about it individually, but I can't ever say globally, oh, anyone can do 2. Not true. Jamie, Kayla, Oksana, hi. Let's see, what can I do tomorrow after my transfer to improve my chances? Okay. Always have faith in God and know that God, wherever you believe God to be or whatever God is, have faith in the energy, the vibration that God is giving all of us. Number 1. All right. Kilts is keto, Kilts is keto, Kilts is keto. Now, Kilts is keto, 1 meal, high fat, low protein, low to no carbs. But even if you're a vegan or vegetarian, it's 1 meal, high fat. That's the key. It's important. You can change it up. Personally, for me, fatty meat is the key. Oh, I put this out here because it always reminds me of the power of something to have faith in, by the way. And so don't lose that. And this is where our immune, whether it's intralipids, Lovenox, Plaquenil, or Prograf, Neupogen, LDN, CBD, Kiltz's Keto Lifestyle. Our new Kiltz's Keto Lifestyle on Amazon, check it out. And we're sharing. And as Dr. V says, sharing is caring. And we're so grateful for the team there. All right, let's see. And we have have a healthy 2-year-old. Oh my God, Kimberly Rose, beautiful. All right. I'm kind of just surfing the questions. I apologize. Maybe we have to figure some better ways that you could say, pick me, pick me. All right. Are there any plans to improve the patient portal? Oh, patient portal and the phones. I'm rocking and rolling right now. We're adding more team members to build the portal, to build access, to build the nursing team, to build all of it. And I'm building and doubling our donor egg team, doubling our answering team, our clinical team. We are in this for the long haul. There's not some magical thing. Dr. Kiltz is going to retire in a year or 5 years. No way. For life, I am in this for you. I've been blessed in this alive category to be a fertility practitioner. And what I've learned is so many opposites are the key. All I need everyone to do is thank you, Dr. Kiltz, for improving the portal and the call team and the global team to continuously improve everything that we're doing so we can continue affordability, quality, and access for everyone, no matter your financial situation, your age, your weight, your size, your gender description, or your outward color description. It doesn't matter. We are here. I am here to help in every way I can. So thank you. Advice for recurrent miscarriages. All right. If you go, listen, again, Dr. Kiltz's concepts are radical and crazy, but I'm sharing and putting out ways that we can recognize that through the fertile journey for all of us, Again, it doesn't matter. We put up a picture, but imagine yourselves in the picture, and that's the key. But we do a lot of the immune 3 and 4, IVIG, Humira, Plaquenil, Neupogen, Prograf. It's all in the book, by the way. It's all there. The antimicrobial, the antihistamine, the anti-endotherapy for 1 to 2 months. I really, really think it's radical. Fasting, fasting, fasting. I intermittently eat. And if you haven't read about fasting, there's so much. A really great book on fasting is, I think, really helpful for everyone. I've been doing a fasting for 10 years, typically 1 meal a day. Occasionally, rarely I'll go a day to it, but rare. We are daily habits are the key. When you can do a daily habit of 1 meal a day at night, rest and digest, infinite mindful meditative moments. Remember, thank you, God, Lord, Creator, for the day. Thank you for all the opportunities we are given. It all starts with the mind, and what you put in the mind matters most. I love reading Carolyn Larson, Sarah Young. I read a lot of the Bhagavad Gita, the New and Old Testaments, the Quran. We all must find something to read to give us faith in all the possibilities. Never, ever, ever, ever give up. So we're improving the portal. We're improving it every day. And we need your help to ideas. I do listen to complaints, but usually complaints we want to run away from, right? Give me constructive ideas that we can all do better. The reason we're sharing so much on the internet and with texting and emails and portals and creating support groups, and all the support groups, doesn't matter which one, bring more positive energy of possibilities. We human beings at CNY Fertility are flawed. We are not perfect, and we are doing our very best due to Corona, the COVID crisis, the financial craziness, the terrible costs of all of this. On the Sarasota interest list, tacos spinaris. I don't know that answer yet, but we're gonna figure it out. Have a reply button to messages. We are building that, and absolutely what we're working to do is the CNY Fertility website and our ability that we can all communicate better and better and better. Listen, I do not want to be owned by a venture capital company that all they want to do is make a bunch of money off us. We are grassroots. We're all working this together. The more we can grassroots it, right, the better. We communicate and we're sharing. That's the key. Share your ideas, your medicines, your donor eggs, your embryos, your sperm. Carry a baby for someone. This is the grassroots. The minions are actually the key for all of us to learn and grow and create in a better way. Fear makes us shut down and run. Worry does the same. What we want to do is stick to the wonder and amazement of life every day. Let's see, how long after hysteroscopy for polyps can you start a cycle? The next cycle or right away you can get started. Get started. Does the antimicrobial protocol come with a trench coat, hat, and dark glasses? Pick up the prescription. Looks like had wild weekend in New Orleans. Oh man, listen, we live a wild life with human beings, right? We are the wild types that have been domesticated and tamed. We've been pasteurized and corralled, but ultimately our wildness wants to come out. Even I bring the wild type of the DNA that's built in all of us. I'm sharing this concept from wild we were to tamed we are, but we want to get back to the wild. The wild can just remove all the chains and barriers that domestication and marketing has taught us. We must hunt and gather. We must make and mend, not buy and get delivered. We're the creators of our own mastery, and we are the temples of life. 5-4 BA to be euploid. It started immature, mature. Look at The biopsy in embryo is not always perfect. We must be careful. Somehow what we think is one thing turns out to be another. We are all perfect. And if we give every embryo a chance, then we'll see that the human being can fix itself. I've been working at fixing me forever. I'm still working on it. And so Tia says, well, you got to fix this and fix that, or what's wrong with me? But we're all perfect in our own way. We must see and believe in the perfection we already are. All right. Hypothalamic amenorrhea since 2011, 10 years now, eating animal-based, only one raw, unripe fruit a day. Fruit is deadly, my friend. I'm sorry. It's not good for us. In my opinion, it contains the plant chemicals that want to disrupt your reproduction. It's, again, animal-based, only one raw, unripe seed. It's kind of like, in my opinion, having a little smoke of something, which isn't good, even just one time. Fats, yoga, praying, that's key. Really, do I have a helpful advice how I could give more tools to my body to heal? The one meal, but you're actually better off cooking that fruit, not raw, by the way, because it contains the arsenic, the cyanide, and all the other phytochemicals, including plant antigens that get disrupted in the cooking. So you're better off cooking it if you insist on eating it. But all fruits are seeds and nuts, and they're the progeny of the plant, and plants ultimately rule the universe, and they are the masters of us because we want to eat them, we want to smoke them, we want to inject them, or whatever we're doing. But in fact, they're deadly for us. I know. It doesn't make sense, does it? Megan, let's see. Ooh, I'm not sure what isn't true. Let's see. I heard y'all one for all, meaning you use the same. No, we do not use the same protocol for everyone. But there are some protocols that may actually be better for most. And I personally have learned that the mini protocols work really nice. Look at, it's a crazy concept. We all think we're individually different, but our DNA is almost the same. And this is the craziness. I know we're all unique and different, but in actuality, if I take a biopsy of a cell and look under a microscope, they're all the same. And what I've learned is this is why meditation, prayer, visualization, that is what you put in the mind, and now what you put in the mouth. And why is keto kick-ass amazing? Because it lowers glucose, gets rid of so many of the antigens and the chemicals that disrupt our bodies. Look at, you can do whatever protocol you think is right. I'm giving you something that I've learned over 40 years of being a physician in practice and training. We don't know very much, but I've learned this. If you want to spend a bunch of money on drugs, we'll help you do that. But what I've learned is less is best. That's the trick and the ticket of this craziness, huh? All right, you guys are good. Thank you for joining me. I'm so grateful every day. I'm loud, I'm fast, I'm hyperactive, I'm ADHD, but what I've learned to do is share a concept and idea that's radically different. I'm a fertility physician. I call myself a Ferrari physician. We are Ferraris, expensive, irreplaceable, honored every day. We turn heads. No matter your size, shape, age, weight, description of color or gender, it doesn't matter. We are the Ferraris, the Temples, the Lionesses and Lions. One meal, I'll give you a little snack and a nap, but infinite mindful moments a day. All disease is caused by the 5 things, and check out Kiltz's Keto Cure and Kiltz's Keto Lifestyle, which is really going to be changed to the fertile lifestyle. You guys are fertile already. We need to change what's flowing through the bloodstream, through the lymphatics, to each and every cell of our body. We change it up. Inflammation is the cause of all disease. The leading source of inflammation is glucose, a high plant-based low-fat diet, and 3 to 6 healthy meals a day. They're not. Thyroid disease, like ovarian disease or kidney disease or whatever disease you have, is caused by the antigens that get in our body via the air we breathe, the fluids we drink, and the food we eat, or the things we put on our body and somehow get in. Those other live organisms, and plants are alive organisms, they too want to live, but they can't run and hide, but they got poisons not added by man, but added by the plants because they rule the universe. All right, immune protocol, have autoimmune thyroid disease, and I medicated as per OBGYN, good. No essay done yet on husband, get it done because it's always egg, it's always sperm, it's always embryo, and it's always the carrying vessel. And the temple is you and I, men and women, women and men. No matter your description of your gender, transgender, lesbian, gay, homo, hetero, doesn't matter. Whatever it is, we are human, live, beautiful human beings. And we must see each and every one of us with love, love always. I am sharing some ideas that I've learned on my journey. I'll be 65 next month, no exercise, typically one meal. I rarely eat anything raw. I do make ice cream, and check out, in the new family building guide is the ice cream recipe. It's in here somewhere. And some of these concepts and ideas are a little crazy. Oh, and Don Clark, our amazing acupuncturist, isn't in this version, but he's getting in there. And I apologize to Don Clark. He's been our lead acupuncturist for years, and I'm so grateful for all that he's brought. All right. Just check out the ice cream recipe, but you can't have it 3 to 6 times a day or a week. You must treat yourself and reward yourself, but do not punish nor sin, or we all do it one way or another. All right. But the immunologic treatments, the autoimmune protocols, are also in our new family building guide. And I would say the immune 2 or 3 is important, but they always include Kiltz's keto lifestyle. What's Kiltz's keto lifestyle? It's simple: 1 meal, 1 snack, and a nap. You must get the naps in. I take naps. Yesterday, like at 3 o'clock, I went to sleep, and I like up and down, but laying down, took really good naps yesterday. And thanks to Dr. Corley and Dr. Faruqi for taking care of the office yesterday. Rock on, really grateful. All right, let's see. Make sure I'm getting all your questions. Mark, good morning. Recently had a consultation. We have 2 questions. You mentioned it's okay to eat French fries. If you can explain why that's okay. Further, same goes for coffee. Okay, look at. We are living a human life in existence. From time to time, we eat plants, no doubt about it. Again, for me, my go-to is a French fry, preferably without the skin, well cooked in duck grease or lard, in my how I do it. But if you insist on coconut oil, okay, hemp seed oil, okay. But simple sugars that are cooked well to kill the bacteria, the yeast, the viruses are okay. But from time to time, remember, the simple sugars are better than the complex sugars. The simple sugars in the GI tract go quickly to the liver, where they're quickly converted to fat to lower your glucose levels. We all eat something that's a carb, a sugar. For me, my ice cream is mostly fat, egg, a little bit of vanilla, and white sugar. My opinion is white sugarcane sugar is better than honey. It's better than those other fruit sugars because it's been simplified to the sugar that's easily absorbed in the gut, taken to the liver, and converted quickly to fat to get your insulin and glucose levels down. There is no such thing as insulin resistance, and we only burn fat for energy. You must be able to convert sugar and protein to fat in the liver or you die. Now, a little bit of coffee, but it may be that the coffee or plant phytochemicals or antigens may adversely affect us. So a couple of cups in a day is enough, not all day. And men and women, Kiltz's keto lifestyle is critical. For me, I do slight Tai Chi and yoga and meditation. Go for a simple, easy walk in nature, holding the hand or holding the arm of your loved one, or walking with your dog or cat if you can, or a friend, but it's a light bike ride. When you heat up the core, you damage the DNA, and that's deadly for us humans, all right? Why would anyone put a bunch of calories into the body, convert them to fat, and store their energy, which is pumped to every cell of the body, including the brain? The brain uses fatty acids, acetyl-CoA, not sugar for energy, my friends. We've been duped. So the concepts are a little critically hard, but it took me a while to figure it out. By cooking the carbs well, we disarm the plant antigens, the plant chemicals, the bacteria, yeast, and viruses. The high plant-based, the raw diet puts a lot of bacteria and yeast in our gut, which ferments protein and carbs, but it doesn't ferment fat. That's the craziness. I know, it's nuts. But if you look at Kiltz's Keto Lifestyle and read it carefully, but don't believe me, it took me to age 55 before I did it personally. I focused on faith first, food second. Kiltz's Keto Lifestyle is critical, but the term keto is just completely incorrect. It's an anti-inflammatory way of living. Even as a vegan vegetarian, if you cook it well, add the fat, hemp seed coconut fat, and eat one meal a day and get off the treadmill, that's the ticket for health and wellness. Monica, TSH jumped from 1.3, 4.5. The Synthroid, your baby's not in jeopardy because it's most likely an error of the laboratory testing. I do recommend adding this. We probably tested too much, but we're simply trying to manage it day in, day out, day in, day out. The most important thing that you and all of us can do, Kiltz's Keto Lifestyle, one meal, one snack, and a nap, and infinite mindful moments a day. As a vegan, vegetarian, Mediterranean, pescatarian, or carnivorian, it doesn't matter. The key is every disease is caused by a domesticated, tamed, pasteurized, cultivated diet that we have been taught by the masters in the ivory tower the wrong information. We are not mainly grazing animals. We're more like a carnivore or a bear as an omnivore. We would preferably eat the animals, and when time is less of the animals in the late summer and fall, we ate the berries, and that is the key. Crazy. Is gluten worse than dairy? What is your thoughts? Yes, gluten and dairy, in my opinion. I only eat cream, butter, and I do eat some cheeses, a little amount. That's really the key. And fiber is absolutely the cause of colon cancer. It causes inflammation, which damages the prostate, testicles, the ovaries, the uterus, the tubes, the intra-abdominal pelvic environment, causes endometriosis, and then it goes to every nook and cranny of your body. It's crazy. Yes, Diana, yes, increased inflammation. By decreasing inflammation, we can decrease adenomyosis. We've got a section in our new book on glycation. We have to write more on the glycobiome, the glycocalyx, which is significantly damaged by a high glucose, high insulin diet. Remember, when glucose goes up, insulin goes up. Our glucose levels cause hyperinsulinemia. Insulin is not resistant to anything. Our brains are. By reducing glucose, that's why one meal a day, cook the carbs well, reduce inflammation, reduce adenomyosis and endometriosis, get rid of the plant phytochemicals, the plant bacteria, yeast, and viruses by cooking them well in only one meal, and by simplifying the fiber is critical. And I've seen adenomyosis go down significantly. This is where I think 2 months of the anti-adeno procedure, which is Lupron, Orlissa, and Letrozole for 2 months. It might even be for 4 to 6 months, but these drugs wreak havoc on our bodies. I know that. And guys, snowballs. Oh, nephew Will is in Malaysia with Nual, visiting and taking care of family. Grateful to Will for sharing a lot of ideas. And the snowball briefs, right, with the cool pack, all right, guys, to cool the testicles. Well, if you simply get off the treadmill and slow it down and cool it down, a lot more yoga, Tai Chi, and all those other things. But don't believe kilts, right? Because kilts is crazy. And we're having fun. And check out on Etsy, Kilts' Cups. I'm putting out more and more and more. I have fun because by throwing on the wheel, it slows me down, keeps my mouth, right? Tea is like, we must listen more than we speak. And the more I listen, the more I learn every day. I'm grateful to all of you guys for joining me, for sharing. Go over to my YouTube. We really want to blow up our YouTube. We're going to be giving out more on YouTube in extra to our monthly stuff. Our books, lots of really amazing stuff. We're really excited about our Colorado, excited about Atlanta, and Sarasota. Really excited. So we have the energy. We're sprinkling it to the universe. We're working to keep our affordability, access, quality. Hey, Kay, how you doing? Active service cannot stay off the treadmill. I know. Okay. Every day. You're right. So when you're doing that, though, I want you to just keep the mental acuity straight. And you know that when you're not doing that, make sure you do at least 10 to 20 minutes in the morning. If you could do it the afternoon and evening, it's meditation and prayer. Really critical for all of us. So, but when you're doing the run, just imagine the blood flow going through your organs, your central core organs, and feeding the ovaries, the testicles, the beautiful energy for reproduction. So if you must, make sure the mind is saying, okay, blood, fill the ovaries, the uterus, the tubes, the prostate, the testicles. Key. Use YouTube Super Chat so people can get their comments highlighted by donations, proceeds, treatment. I love that. We're going to do that. Let's see. Hannah, Will, Pat, help us all do that. Super Chat so we can take all the proceeds to go in affordability, quality, and access for everyone who applies. The line is long, but the trick to all of this is patience, patience, patience. Period while priming with estrogen progesterone, because Nurse Lori said I would, however, I have. Listen, it's okay, even if you get your cycle. I'm working on my team. Hey, team, estrogen, progesterone, HGH is okay. Stay on it. Get a menses, it's okay. Get a baseline on the drugs. If then we start you on your meds and we stop it. Mrs. Tiat, high five. Love you guys. And we're all sharing an amazing energy. I became a fertility specialist by chance. A cold call by someone said, hey, do you want to do a fertility fellowship? I learned along this journey that things show up in ways that we go, wow, we are the gods and the gods are all of us. And we have the ability to see the possibilities. Done that priming before and I get period after 3 days. Mercedes, stay on it. It's okay. Whether you get a cycle, where the egg cycle, the uterine cycle, the testicle cycle are all sort of running on their own energy and going in their own direction, right? We must simply, we're doing something different. Lower meds for all. Mini. That's the mastery. And agonist-antagonist conversion for low AMH. That's okay too. Lupron, stop it, then go to the antagonist, gonal, centrotide, Ganirux, or even Orlissa. And we're really working on the low dose, the duo triple stem, affordability, quality, and access for everyone. So many have been shut out because of their financial, their gender descriptions, their color descriptions. We are here to make sure we open up and be accepting to all of us. We are human beings, no matter your size, shape, age, weight, gender, color, description. God is in all of us. And for me, I have focused on my Christian philosophy, which also fosters into Islam and Judaism and the Bhagavad Gita. But all of this, no matter your belief or not, we are the gods, and we must honor each and every one of us. Notice some light pink, light red spotting. Kaylin, yes, it's normal. Scared first time retrieval now Tuesday morning. It's okay. And we're really working to emulate and bring in all of our team members to understanding Kiltz's keto and the CNY fertility way. That's really it. So thank you guys all for being part of the journey. Let's see. Posting it over. Let's see. Kaylin, are you posting it over and over, or is it my Facebook messed up? You know what? I don't know. All this stuff, I'm working to get Will and Patrick and all of our team members helping me make this work and look better for everyone. And so when our team comes into it, I'm really access. Hannah's daughters, and we must emphasize access for everyone. We have been shutting too many people out for way too long. We were all wild, and we've been corralled. We've been captured, enslaved, servants, peasants, soldiers, and slaves. Our job today is to put out and open the doors for everyone. That's my job at CNY Fertility, to continue to lead and open up to new and different ways. My doctors, practitioners are learning every day, and we are opening up for everyone. Thank you. I've expired follow in 4 months with severe. My bet is it's probably okay, but Dr. Kiltz said it was okay. I didn't say it was okay. I said probably it's okay. All right, let's see. Birth control to wait for PGT results. Can I stop birth control, proceed the day after results? Yes, you can. I'm not a big birth control fan. I like Prometrium and estrase a little bit better. And we all need to be patient every day. I'm working on patience. And all right, let's see. Currently going through failed transfer as a chemical 4BB, blah, 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 donor. From donor test not tested, what are the chances of this happening again? I have 2 more 3BB. I'm not a big tester of embryos because I can't change the outcome of the embryo. But if I label it normal or abnormal, and then it doesn't work, and we say that, we know why, but we don't. They tested me long ago and threw me into the heap. But in the heap of the junk pile, I came out. And what I've learned is when the fire of life, we grow. If you're feeling the pain or feel shut out, accept that energy is that which is pushing you to see the light. And the light is all we have. Every day, we must believe. And by CNY fertility, I don't know. I've got to change it up, but we create some ideas. But you can't change the embryos. You can only change the body, the vessel that carries this baby. This is where Kiltz's fertile lifestyle matters. It's for everyone. It doesn't matter if you're working for fertility to have a baby or help someone else, but all disease is caused by a domesticated, tamed, pasteurized, agricultured lifestyle. We are meant to eat the fat, and we don't. We meant to eat 1 time a day, not 3 to 6 times a day. And we're meant to not add the food and burn it on a treadmill. We're meant to eat just what we need when we eat to live rather than live to eat. We've all heard these things, right? This is the crazy, amazing concept that I've learned. All right. Strong Mommy, how you doing? Nice to be seeing and talking to you. Levels, should estrogen progesterone levels be on frozen transfer? All right. I typically like to see the progesterone greater than 10, estrogen greater than 50. But our number is typically 200 for estrogen and 20 for progesterone. But that leaves a really large variety. After you start your progesterone, quite commonly estrogen drops, even in the 10 to 20 range, by the way. So there's not a should, it's we look at it and we adjust it a little bit because we like to have a cushion, don't we? We know that if it drops below this, but we like it up here, not way down here. Crazy, right? I know. All right. Tony, how you doing, Tony? Let's see. I've got this. Wait. Let's see if I can get these clicking right. Am I good to take all my supplements? All right, supplements. All right. We've got the molecular fertility supplements. And we've got this in the New Journal magazine. We have the molecular fertility, male and female, plus the ovarian bloom for those with some ovarian damage, egg damage, or DOR. We've got the omega-3 fish oil. Eat the fish, eat the fatty fish, fish stew, right? Eat the sardines, the whole sardine. It sounds nuts, but if you're a vegan or vegetarian, cream and butter is critical because the fat-soluble vitamins, A, D, E, K, critical. That's in the fat. But if you eat the liver, it's always best. But if you eat a drink or eat seaweed oil, that's another one, which actually may help heal the glycocalyx. You should consider doing what they do in the UK and offer IVF exchange for eggs. Lesbian couple, moral pravity. Yes, sorry if I pronounced that wrong. We do that. We offer, like if you donate some eggs, we can help do IVF. We need help in organizing all of this. The more we do this together, the better. We are a sharing and caring team. Check out Erin McCullough's Fertile Hope Yoga, Danielle Bertelli, The Fertile Spirit. Check out The Fertile Secret on Amazon. And I throw a lot of energy out there. You know that, right? But then I get my rest and I digest and I get my one meal a day, which for me, it's fatty meat. Cook the carbs well, add the fat, one meal a day. And seeds and nuts in the raw want to kill us or disrupt our reproduction. I know. CBD oil, recommend. CB distillery, but CNY CBD, I'm working on that. I'm working on it in a way that we can share it and get it out there and helping you guys get what I think is the very best quality out there. All right. Supplement prenatals, one super meal, a meal to help stick with intermittent fasting, keto, intermittent feasting, by the way, intermittently feast, but fast at least for 22 to 24 hours a day. I know in theory, doctors recommend to take them all in the morning. I would say when you take them at night with your meal, you're fine. I don't know where we get all this craziness. And if what you're doing isn't working, we're going to help you do it differently. And no matter where you're going, those fertility doctors out there in Texas and California and Florida and Tennessee and Michigan are awesome. We're all learning and working this together. That's the key. Molecular fertility. We're putting the add-ons, all these amazing things. If you buy a 3-month supply and you keep it on going longer, we're going to get bigger discounts. Will and my team are working on ways to make it better and better and better. And I apologize for us somehow making mistakes, but efforts to have a more diverse pool of egg donors. Hannah's daughter, we are working, and my job this month, this day, and every day is diversity. We are working with you guys to help us build our diverse pool. We are in a pool of diversity. We are not here to be in the one way this way, one way that way, and one way another way. Diversity is the key to all of us, our DNA, our exterior, our interior in life. We must all work to be diverse together. When we hold love, the links build. When we hold anger and fear and worry, they're cut. And we together are going to kind of really create and grow in amazing ways. All right. Let's see. Nicole, 6 weeks, 3 days, subcutaneous hematoma, led to lots of bleeding. Likelihood of another. Okay, so inflammation causes the subcutaneous hematomas, kills us keto. Throughout pregnancy, pre, pregnancy, and beyond life. We are healthy and well because when you're pregnant, your baby is always burning the fat you have here. When you eat 3 to 6 plant-based meals a day, the plants are working to kill you and your baby. I know it doesn't make sense. This is the game-changing advice. Add the fat, up the steroids, add some antibiotics. This is critical and key. And it may be reasonable to bypass the ultrasounds for a few extra weeks. And this is where weekly intralipids, even every 2 weeks of IVIG. I'm a reproductive immunologist. CNY Fertility is a reproductive immunology team. We recognize that the test doesn't matter. We know inflammation is the cause. By adding Humira, IVIG, by adding lipids, Lovenox, Plaquenil, Prednisone, Neupogen, and staying on these things, including progesterone throughout pregnancy, and LDN and CBD, and go slow, get off the treadmill. The modern domestic recommendations are 3 to 6 plant meals a day and exercise. This is the cause of our deadly diseases. We are wild type ancient hunters. We ate from time to time. We can walk down anything, but to run is not what we were. And to intentionally get on a treadmill and burn the precious energy that took a lot to collect the calories is ridiculous. Let's see. Okay, molecular fertility. I don't know if you guys can clearly see it. There's a molecular fertility there. This is the female version. All right, you guys see it? All right, let's see if for some reason my light may be a little bit off on my Instagram. Share on TikTok, share on Instagram, share on YouTube, share on Facebook. The more we grow, we need more diversity in our team members. We're working to grow our global call team, our global donor egg, embryo, sperm, and gestational carriers, by the way. We need more that want to donate and help others in life. We want to give to the homeless, to the poor, to those that are in an orphanage. The more we give, the more we can live. And we must believe, right? And I know we change it up a little bit, right? But believe and living is because we have faith in God, and God is in all of us. No matter your religious or non-religious beliefs, God is the power of the mind, and we have that power, and we're sharing it in more and more and more healthy and amazing ways. Let's see. And let's all work to diversify our egg donor, sperm donor, embryo donor team. Let's bring everyone together in so many ways. We're excited for Dr. Condrup to be joining us in our Sarasota team, to be creating both our endometriosis and our fibroid for fertility team members, but also it starts as monitoring, but soon will be an egg retrieval and embryo transfer. The same thing with Atlanta. We're building our Colorado. We're excited to have Dr. Fink and Dr. Joshuman and our team members. We are building the team with you guys as the leaders. This is a grassroots energy of affordability, access, and quality. We want you guys to realize that you really own and run what we do. We're listening to you. We're growing to what you want. And that's my motto in life. All right. Transfer, days, hours may differ depending on your needs. Strong Mommy. Yosvel, Cuba. We see so many coming from Cuba, from South America, Central America, and Mexico. Dr. V and the team is building our Spanish-speaking coalition, but Dr. Faruqi building our French, Montreal, Canada, and growing team. We are working for you guys to grow and create in amazing ways. So thank you for your questions every day. I can do this 24/7, 365. But I too have to take the calls, get into the team, help guide and direct, help retrieve some eggs, place some embryos, and guide all of us. And if you want Dr. Corley, myself, or any of our team members to pray with you, we will do that with you. because ultimately we are all bringing the energy of love and life through prayer, meditation, and visualization. Never give that up. All you have to do is ask. You want a picture with us? We'd be glad to do that. We are working to share maybe on some other ways. We want your stories on video, that we get them shared, that we can maybe share with others through our YouTube, maybe TLC, right? If we can all share a way that we all are the grassroots of fertility. It's opposite and different, I know. And whether you're vegan, vegetarian, Mediterranean, pescatarian, or carnivarian, or whether you believe in God up there or in here or not at all, it doesn't matter. We here at CNY Fertility are here to help and support all of us. We are human beings. We must help heal through our hearts and the global world, but the universal concepts are really, really important. Take PIO shots and B4 suppositories after transfer. Strong mommy, look. Whatever you're doing before transfer, stay on it after transfer. Those are the recommendations before, and stick to it. I know sometimes the electronic records are imperfect. Don't stop what you're doing. Keep doing what you're doing. And please ask the nurses, can you please look at my instructions and make sure they're correct? And I know we are so crazy busy, but being busy is better than not. And we're here for you, and we're learning every day in every way. Happy, joyous Valentine's Day to us all this day. When we share love to the person in us and in front of us, and all of us together, love and forgiveness, no judgment. There are thoughts, ideas, and concepts that we're learning together. Brittany, hi. Does BC help dissolve residual cysts after IVF? I personally time, but I don't think those cysts are harmful. I think we're just looking at the baseline to know what's there. Okay, I now know it's there. What do? I know what I'm going to see the next time. It doesn't matter when you start your stems, because the ovary and the uterus are working at different time frames. If we're trying to do a fresh, okay, the birth control pill for a week, we scan. And then we stop it and start whatever you're doing, whether you're doing a fresh or frozen, you're doing donor eggs or your eggs, donor sperm or your sperm, donor embryos or your embryo, or you're using a gestational carrier. My job as a global leader in the fertility realm, because I'm learning from so many amazing experts that have taught me through the fertility world, I honor each and every one of you as we're all doing this together. Cysts are okay, team members. Cysts don't stop you. It's your levels of hormones and what your lining looks like. A cyst is okay all day long. We make cysts and then we transfer embryos and people get pregnant all the time. You guys, by the way, are the leaders in teaching all of us what's Kilt's talking about. What is thinking on his mind? What's the crazy guy doing in the pottery and painting and poetry of the day? By the way, Wojtek Polanski was my first full-time embryologist at CNY Fertility, and he helped me say, hey, let's call it CNY Fertility. So I give, and Teresa Kellum also was one of my first embryologists in Syracuse, and I give her great honor and thank so many that have come before and helped our team grow and grow and grow. Let's see. Carrie, I know the 10% versus 25%. We're working on ways to keep it moving and keep it moving. I would give it nothing down. We need everyone to keep flowing with the addition so we can keep moving forward. We increased it to 25 because a lot of people weren't keeping up with keeping the river flowing. The river must flow and not dry out. And so we're going to continue ways to make it affordable and have access for everyone. High cytokines, Nahid. All right. Inflammation is the cause of all infertility, all cancer, all heart disease, all damage to sperm, eggs, embryos, and the rest of the body. Cytokines are just another label or signpost of, I have inflammation. I already know you have inflammation. I don't need to measure cytokines. But heat, redness, swelling, pain, dysfunction are all signs of, so are high white counts, ANA, ACA, lupus, NK cells, and cytokines, among other markers. We don't need to measure markers. I know you have inflammation. It's primarily caused by sugar, high plant-based diet, and remember, lettuce is sugar. Phytochemicals, plant antigens, the fermentation of fiber via bacteria, yeast, and viruses in the bowels, and excess exercise by the domesticated human animal that sold a concept that's killing us. But when we get to our human ancient DNA, we're the wild ones. We didn't run and run and run and burn our energy and then eat food and say, well, let me go burn energy again. That's the key. Can you continue antihistamine protocol after pregnancy? Yes. So again, let's make sure this is online, my team, right? And thank you to Pat's team and Kim and let's see, Kim and the rest of the team, and my brain goes blank in the moment I need it. I can barely remember my own name sometimes, but the family building guide. And again, prices can always change without notice, by the way, but right now we're holding strong to all of these. But in this, you'll see the list, and I've got a few minor changes to the list, and I'm going to get Will and the team, because my mini cycle is, again, whether you're doing IUI, IVF, or anything, it's really, really, really knowing that. Let's see, one more page, and I'll get there. Let's see if maybe I can get it working there. Here are the immune protocols, the different stimulation protocols. And for men and women, it's always, always, always Dr. Kiltz's keto for fertility or Kiltz's lifestyle. But I highly recommend I do a lot of 10, 220, which is 10 letrozole, 200 of gonorrhea. I'm working with Empower Pharmacy and others to get the very best, lowest prices, that when we can then help get them to you in better and better and better ways. And at CNY Fertility, our focus is affordability, quality, and access. And again, the 25% down is our way to help those who need the financing to keep going. Increased TSH minus normal. When I added TSH goes to 5. These supplements, I believe, are competing with the laboratory testing, but it also may compete with a little bit of the binding sites and give more free thyroid hormone. So these are definitely factors. Rep Chest High, 36 years young, AMH 0.385. The 330 ganirelix E2 too low. Listen, in my opinion, this is where Kiltz's keto lifestyle is key. The Fertile Feast is key. Check it out on Amazon. But 10, 220, keep it low. Do it a triple stim. These numbers don't mean you will or won't get pregnant. They're just kind of signposts to say, I believe a low AMH says I've got a ton of inflammation. I've got a ton of inflammation. Why? Because my GI tract is highly inflamed. You guys know that the GERD, the bowel problems, the pelvic discomfort, the urinary and the bowel problems are all part of human trauma and disease. In my opinion, fermentation in the colon is the leading source and cause. I had it as a kid, as a teenager, migraines, arthritis, psoriasis, bowel bleeding. Personally, when I went to one meal, one snack, infinite naps, mindfulness and meditation and prayer, personally, I went to carnivore fatty keto, game change, amazing. And yes, the Mucinex for frozen. So my team is working on understanding what this all means. My next step is to fix all of us, but There's so many moving parts, as you can imagine. That's why I shared on my live with Kilts, right? But it really is, you guys are listening and learning and bringing it to the forefront of our team members. Tell them what you want, whether you want a high dose or a low dose. Laparoscopy, hysteroscopy for pelvic endo inflammation. I've seen so many people suddenly get pregnant after it, even though they say, you don't have endo, you have no signs. The leading sign is infertility, repetitive losses, failed implantation. I look great and feel great. My friends, if you're infertile, the cause is inflammation. And pelvic inflammation is the cause, and it's coming from the gut. The gut has got us, and it's got a stranglehold. If you just stop eating the fruit, the fiber, the vegetables, the seeds and nuts, and go to a cooked meal with the fat, and one meal at night, you will never ever forget. And it just is a game changer. It's a game changer, a blessing in my life, and I've seen it change so many lives. Hypertension, diabetes, strokes, cancer, irritable bowel, and migraines, ALS, MS, depression, anxiety is all due to a modern, healthy, domesticated lifestyle. 3 to 6 healthy plant-based meals a day. Do it in one, add the fat, get off the treadmill, and have faith. Mindful meditation of gratitude attitude is the key. Does the way you implant differ in someone who has adeno versus someone who doesn't? Let's see. Peel Morena. Inflammation, again, if you have adenomyosis, it's inflammation. This is where I think the 2-month anti-endo, antimicrobial, antihistamine, and Kilts' keto fertile lifestyle is critical and key for all of us. Doesn't matter your size, shape, age, weight, color. We have been captured as peasants, soldiers, and slaves and servants to the master, has taught us how to eat a frequent plant-based diet, low fat, and go to church. But we are the temples, and the church is within us. If you have faith and believe in God, the highest power, no matter the church you go to, recognize that you hold the power. If it's not working, something's wrong. I do believe that everyone has some form of inflammation. That's why you're here. And whether you have adeno, endo, or no obvious source, it's inflammation. We need to do everything we can. Let's see, 5 weeks today, Omnitrope really worked. In Cervital, I personally think the Omnitrope 3 in prime, 6 in stem, but keep it low. Mini dose matters. And whether you think I'm doing the same for everyone, I know that you have inflammation. I'm sharing an idea that is really a global concept. It's more of a blanket approach rather than a shotgun approach. We need to add the fat because the fat turns out to be the soap that cleanses our bowels, cleanses our bloodstream and our lymphatics. And fat is not the cause of heart disease. Sugar is. And vegetables are the cause of all disease, not fat, my friends. All sugar, all plants, all vegetables convert to sugar and then to fat. And then you get fat. And then we wonder why, oh my God, fat's the cause. No one is eating fat that I know of. They're eating the wrong thing. Let's see, soon to be Mrs. Merritt. Wow, I didn't get that. I have chronic GI issues. Elizabeth 001. We all have chronic bowel problems because that's the seeds of disease. What you put in the GI tract is for an herbivore, not a carnivore. We are carnivore-like. Okay, we're omnivore. We can eat the plants. But you and I have been domesticated. We've been enslaved by the masters in the ivory tower, and we believe them. They don't intentionally tell you the story. They actually have cognizant dissonance. They believe one thing, but the opposite is true. You and I are lionesses and lions, not pigs and cows. We are meant to hunt, and we are hunters. And I know it's crazy. Kilts' keto fertile lifestyle. Whether you have keto in there or not, it's technically the labels we use that give us some guidance to get to an idea. But Anders Sienfeld, Georgia Eads, Ken Berry, Maria Emmerich, check out Marie and Craig Emmerich. They are a game changer, and check out their books. We are sharing, and we're looking to get more for you guys, and then we're going to gift more to you guys to build a fund to help those that can't afford it. And if we all step into this with belief, and if you know that you can afford whatever you think you can afford, and if you haven't checked out my books, The Fertile Secret, the secret is simple. The 3 magic words are I am, God, fertile, having a baby, building a family, alive, beautiful, lucky, and gifted. When each and every one of us step back to that. I've been sharing videos for 15 years. First, my daily intentions and inspirations, and then to my Facebooks and my lives on the Fireside Chat. And I'm grateful for so many that continue to share. Jeanette, sorry about the miscarriage. All right. Laparoscopy, hysteroscopy, Kiltz's keto lifestyle. It's craziness, but it works. And never, ever, 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 ever give up. Always have faith. And pain is the pusher to get you off the couch to seek ideas. And all of us together, let's make it for free. But nothing truly is for free. You must ante in. You must recognize the universe will give you what you give it. And when you see the beauty of either Islam, Christianity, Judaism, Hinduism, Buddhism, or whatever your ism is, it's faith in God. Whether you're an atheist, agnostic, or theist, it doesn't matter. Faith in God within all of us. And human medicine starts with how we connect with people. The more we connect in a positive, loving way with the people in front of us. And sometimes we jump back because we are afraid, because sometimes anger leaps out at all of us. But we want to stand still and embrace everyone together. And I am sorry to hear about your losses, your failed cycles. We are going to work together. And our Fertile Village at CNY is going to continue and do our very, very, very best. Keto for fertility. Second cycle, fantastic, 6 weeks pregnant. Doctors are telling me, you must stay keto, my friends, because keto is kick-ass, the most amazing thing. When you begin to look at the mammals that actually fast when they're pregnant, and most of us doctors don't understand fasting. And fasting is the key to a healthy life. And I know what they tell you to do, but they're wrong. And I will bet $1 billion in my life, and my license, and my capability on this one. We are eating the wrong things, and plants, they're the predators. And sugar causes glycation, and it wants to damage your placenta, your blood vessels, and ultimately the plant poisons want to kill us and kill your babies. I know. It doesn't make sense. Any sort of meat is the key, and fatty meat. And paleo is a fatty meat diet, my friends. And red fatty meat and liver is the key. But listen, if what you've been doing isn't working, this is the game changer. I know. Low fat is deadly. It's keto and paleo, my friends, is a high fat, low protein, low carb diet. That's it. It's very confusing. They don't understand the human Ferrari like I have lived it myself personally, 10 years. Bleeding, arthritis, psoriasis, kidney stones gone. Paleo, okay, but keto is king. But low fat diet and low carb diet is not the way. We have been taught the wrong thing. Why do we give intralipids? And fat is the soap, and you need it in the bowels. They're telling us wrong. I know it doesn't make sense. But I'm grateful to everyone for sharing. And if what you're doing isn't working, why do we keep doing it? Western medicine, the costs are going up. The diseases are going up. The communicable diseases are going down. Arthritis, psoriasis, kidney stones, migraine, cancer, and infertility is on the rise because we're eating a high plant-based, low-fat diet. And Lean meat is not the way, it's fat. And fresh or frozen are both good, my friends. And you must have faith in God, and God is within all of us. We are the emulators and creators of God, and love must be shared first. In my opinion, again, Kiltz's fertile feast is critical and key for all of us. All right, one more question, Elizabeth, and one more on Facebook and YouTube. Finding a benign ovarian cyst by happenstance, the doctor told me I have endometriosis. Of course you do. We knew that. Normal periods my entire life, every 28 days with mild cramps. I know this, but endometriosis is from bowel inflammation. It's from a healthy lifestyle that we're not eating. A high plant-based variety, my friends, is deadly. High fat, low to no carbs, low protein. We don't need very much protein, but we need the fat. And you only make fat in the liver via insulin. And a high sugar diet makes us high insulin. Deadly. All right, one more. Let me get over here, you guys. Thank you very, very much for all your sharing. I'm going to continue my Sunday lives. I'm working on some more to share with you guys, but I must make sure I get my rest. I get my one meal, and thank you, Tia, for always getting me the very best steaks and liver, salami and cheese. And from time to time, I make my ice cream. Again, check out the Kiltz's Fertile Feast on Amazon. We're getting it to the Audible, the Kindle, and more. And thank you, thank you, thank you. Do you, Jessica, do you have DOR or any autoimmune issues? We all do. We all do. And remember, the plants are the predators and they're trying to kill us. You can disarm them by cooking them well and add the fat in one time a day. But if it's all the time, it's deadly. All right. Ember, should I prime with Omnitrope? 1 to 2 months, I think, is good. More than that, not necessary. But Kiltz's keto lifestyle is best. All right, you guys. God bless you. Thank you for giving me a little extra time. I appreciate you guys. And get some rest. Spend some time with Miss Tia today. A happy Valentine's. And remember, listen twice as much as you speak. And I'm practicing. And emulate love to the mirror and everyone around you every day. That's the best way for all of us. But if what you're doing isn't working, you got to turn it around. And Kiltz's fertile lifestyle is the game changer. God bless you, my friends. I love you, and I love you.